exercising this morning with that stuff. Good morning, everyone. So my name is Alyssa. I'm a speech pathologist at Sarasota Memorial Hospital. I was in the outpatient setting for about 5 years, where I worked with several individuals with Parkinson's disease, as well as many other diagnoses. Now I've switched over to the acute care side, where I treat patients when they're admitted at the bedside. My whole discussion for today is being proactive and getting that therapy so that you're making strides, staying away from the declining speech and swallowing deficits. And I'd like to keep you out of the acute care side and on the inpatient side for exercises. So we'll be discussing speech changes associated with Parkinson's disease, swallowing changes, and then interventions. What can we do to address those speech and swallowing deficits? So, to understand how we're able to help with those changes, it's really good to understand what occurs with Parkinson's disease. I told Dr. Sutherland I've never had to do this before, a neurologist, so bear with me. Parkinson's is a progressive neurological disorder. So there's a loss of neurons within the substantia nigra. This loss of neurons changes the amount of dopamine that's produced, a neurotransmitter that's critical for movement and coordination. By the time you're diagnosed, studies show that there's already a 60 to 80% reduction in dopamine. Most studies showing closer to the 80%. That dopamine is critical for automatic movements. We're going to learn how speech and swallowing are automatic and how that affects your production of speech and swallowing. It is highly treatable. That's why we're so passionate about therapy and getting you in with one of our Sarasota Memorial clinics, so you can target speech, swallowing, balance with physical therapy, upper body movement with an occupational therapist, and just overall quality of life. This diagram shows the substantia nigra, what it looks like when it's normal, and then with the depletion of the dopamine, or neurons. So, if it's an automatic movement, why does that affect my speech? Once you learn in infancy how to speak, how to make those sounds, form as I'm doing right now with my articulators, you never think about that again. You think about what you want to say and maybe how you say it, but you don't think about how it's formed. It's automatic in nature. That loss of dopamine disrupts that automatic function. Without the dopamine, the muscles become slower, they move with reduced range of motion, and then in turn become weaker. Weakness is not one of the cardinal symptoms of Parkinson's, but it is a result that occurs. Those weakened muscles result in your tongue moving with less range of motion to form sounds, our mouth opening with reduced aperture to make certain plosives and sounds more clearly. And as a result, our speech declines and we have difficulty communicating. So what do those changes look like? You can have lower volume, less inflection, this sound can become more monotone, mumbling or trailing off at the end of sentences, word finding difficulties, slurring of speech, speaking too quickly or slowly. And what's even more frustrating is because of the changes with the sensory system, individuals often are not aware. So you hear things like, I can't hear you, speak up. You're at a restaurant, you order your meal, and they can't hear you, and you think, well, there's nothing wrong with my volume, they must not be able to hear. So that part's frustrating. But testing with a speech pathologist is very helpful because we can use biofeedback techniques to let you listen to your voice, see testing to show the volume is lower, and just bring better awareness. What does speech intervention look like? You would be evaluated by a trained speech-language pathologist that's trained in Parkinson's disease specifically, so they know what to listen for, what exactly to treat and how to target these systems. This does require an order from a physician. You would just request speech therapy. And once you get to the clinic, we can tell and complete those assessments to give you the most individualized plan of care. There are several research-based programs that improve the changes associated with Parkinson's disease. SPEAKOUT is a great program that's come about in the last several years. It has a very functional program as well as a maintenance program that is wonderful. We offer that at the Rehab Pavilion and Clark Road. So you learn with the speech-language pathologist these exercises and how to target the deficits, and then you get to come to a weekly meeting to reinforce these exercises. And we'll talk about why that's important at the end. It's also wonderful as a resource for a support group. You get to be with other individuals that are working on the same common goals, and we allow time for patients to chat and kind of discuss things that are important to them. We teach you how to be intentional. What does that mean? So with the reduction of dopamine, we use a certain motor track within the brain to create automatic movements. There's a separate motor system within the brain that, if you will, takes a different route and uses a more intentional side of things. So for example, if I'm on the phone telling someone how to spell my last name, my new name is very easy, but my old last name was Vaughn. So a lot of people didn't really know how to spell that. So I would increase my volume, increase my clarity, and spell out my last name. V-A-U-G-H-A-N, right? We're very intentional. We want to make sure they hear us and can understand. When I'm talking with my friends or my family, I'm not really thinking about what my sounds are sounding like or how they're coming out of my mouth. So I've switched from a non-intentional to an intentional system to meet my goals. We teach you how to do that in everyday life because, again, due to that reduction in dopamine, your speech production will have to be used on that intentional system to come out clearly and to be heard and understood. Exercise is key. I'm sure your doctors have talked to you about exercise with movement and balance, making sure you are staying strong, able to walk, doing those exercises. The same thing applies to speech production. We have to use those exercises to increase our breath support, to increase our volume, and make those sounds with clear intention. Singing is great. It doesn't matter what you sound like. You can sing out loud, in the shower, in the car, that's great. Reading orally, read the newspaper out loud. That's a wonderful exercise. You can read letters or things you're reading online. Oral motor exercises. The speech therapist will give you exercises tailored to you that help improve oral articulation. Medications, always follow your physician and take those timely and consistently. So, swallowing. Communication is obviously so important. That's what makes us humans, right? We want to be able to talk, be heard, communicate our wants, needs. It's very frustrating when people can't hear you and ask to be repeated. We oftentimes just quit trying because it's so frustrating. So that's very important. Swallowing, on the other hand, is just as important, if not more, because the outcomes of difficulty swallowing are much more impaired and can cause severe outcomes. So we only have one mouth. The same structures involved with speaking are involved with swallowing. Articulatory, the mouth, tongue, lips, cheeks, and jaws. Those are involved with speech production. That's how I'm making all my sounds right now. They're also used with swallowing, chewing the food, the tongue lifts to start the swallow. Again, you never think about these things until something changes and it's no longer automatic. The phonatory system, the vocal cords, that's how I'm making my sounds this morning. They also seal tightly at the top of our airway. As you can see in this picture, the front tube where it's pointing to the larynx larynx, that's your trachea, and the indention, that's where the vocal cords are. They close tightly to protect the airway when we swallow. And then finally, the respiratory system, the lungs and diaphragm help me build up my breath support so I'm able to speak, but then also help to build up air pressure to cough and clear any material that may go into my airway. So, you get to kill 2 birds with 1 stone. We come into therapy, we target speech exercises, but then we're also targeting those muscles that are so crucial for safe swallowing. So just as I said, speech and swallowing no longer function automatically. The muscles reduce in range of motion, reduce in strength, and the movements become too small. We need our muscles to strengthen, squeeze tightly, and elevate for a good swallow. That starts to weaken, not because it's no longer functional, but because we're not using it to its full potential. Individuals with Parkinson's disease will often tell me, I have so much more saliva. It's just always in my mouth, building up. If I look forward, it spills out. Sometimes it makes me cough if it spills backwards. It's not necessarily an increase in saliva production. It's because you're no longer managing it automatically swallowing. So due to gravity, it's either going to fall forward, pull in the mouth, or fall backwards. And that could be why you cough out of nowhere when you're not eating and drinking. Difficulty swallowing, or the term we call it is dysphagia, occurs in 80% of individuals with Parkinson's. It typically starts out more mild and then increases with severity along with disease progression. That's difficulty swallowing food, saliva, or liquids. Now, that's all a bunch of bad news, right? But what can we do about this? Sorry, let me explain a little bit of the symptoms first, then we'll talk about what we can do about it. So, some signs you may see that you're having difficulty swallowing. Sometimes we aren't aware, and they start so mild, we think it's a small problem, but it's something that we want to take care of early so it doesn't become a larger problem. You may notice wet vocal quality, coughing when you're eating and drinking, an inability to swallow, food or liquid sticking in your throat, that saliva loss in either the front of the oral cavity coming out of the mouth or down the back of the throat, bringing food back up, unexpectedly losing weight. If you're not trying to lose weight and you're losing weight, sometimes that's associated with difficulty swallowing. Having to cut food into smaller pieces, or medication sticking. That's often something some of my patients tell me first, is my medicine just is not going down as easily. So what is aspiration? Aspiration is when food, liquid, or saliva travel into the airway, through the vocal cords, down the trachea near the lungs. There's a very high risk of developing aspiration pneumonia, which can result in hospitalization or death. So we definitely want to get you in early with a speech pathologist, assess you, and get you started on a preventative program, or see where you are along the continuum, so we can get intervention. This again results as a weakness, reduced sensation, or weak cough. So in the first picture, these are images from what we call a video swallow study. So we are able to get a test done where we can see what exactly is happening with the swallow. The speech-language pathologist would determine if this is necessary. We can also see a lot in your appointment, and sometimes it's not necessary to complete this at first. The first image shows aspiration of liquids going into the trachea. It's the first thin line in the tube towards the front of the neck. The second shows difficulty swallowing solids. So sometimes it's hard just to chew up solids and clear that material due to weakness. One big thing I want to stress today, an issue we have in Parkinson's disease is called silent aspiration. So we just discussed aspiration. I'm sure all of you along the continuum have had this before, where you swallow, maybe you're a little distracted, we cough our heads off and say, ooh, it went down the wrong tube. That is aspiration. Unfortunately, with the reduced sensory system, sometimes it can be silent, which means there's no reaction whatsoever. We do not have a cough when it goes down towards the lungs. So that's why it's so important to be seen by a speech-language pathologist so we can assess and get your case history and see if you're at risk for this. As you can tell, because we're not coughing, we don't have any signals of this problem, there's a very high risk of developing pneumonia with silent aspiration. 89% of individuals with Parkinson's disease demonstrated reduced sensation or reduced awareness of food or liquid in the throat and going towards the wrong area. Now, that was the end of the bad news. Now, what are we going to do about this to prevent some of this decline? Dysphagia intervention, so important. I'm very, very passionate about getting in early, seeing a speech pathologist so that we prevent decline and slow the progression. You would start, as I said, with a speech-language pathologist, get evaluated. Again, this needs an order, and we will assess your level. Every individual with Parkinson's is a little bit different. Of course, we have the cardinal symptoms, but everyone's going to be in a different line of where they are along the continuum, and that's our job to see where you are and provide exercises. Some things you can start doing right now would be to implement some safe swallowing strategies. Make sure you're always upright when eating and drinking, so that way the airway is not open and causes an increased risk of food going down the wrong way. Avoid distractions. Limit TV time, talking with others. I know eating is very social, but make sure you chew and swallow before you respond to a question or talk. Chew food very well, take your time. Alternate solids and liquids, this can help clear material. Take small bites and sips. Control reflux through dietary habits or with your physician. Adequate hydration is key because then you're keeping the mucosa wet and able to move material. Swallow, swallow, swallow. So if you were to fall and break your arm or have some issues, you would obviously go to the gym and work with a physical therapist to strengthen that area. The same thing applies to the swallow. We want to get you swallowing in a functionally safe way, so we strengthen those muscles. And remember, be mindful. We have to switch to that intentional system because the automatic system is no longer helping us to its full benefit. So be mindful, eat slowly, and take your time. So we're going to practice an exercise everyone can do here today. I didn't want to give you a voice exercise because everybody's at a different line of the continuum. So we're going to practice some saliva management. So I want you to gather your saliva and swallow. Swallow with purpose. Swallow like you're going to swallow a great whole. I want everyone to try it with me. So we gather and swallow. If I were to say start swallowing more, that's pretty difficult to continue that and start when we already know we're having trouble with that automatic system. So I want you to take that exercise and pair it with things in your everyday life to become more intentional and make it more of a routine. So if you're reading a book, every time you turn the page, I want you to swallow. Patients, again, will often tell me when they look down to read the newspaper, they'll notice the newspaper gets a little bit wet. So if you're swallowing, that's not going to be a problem. If you're surfing the internet, every time you click the page and change, or click the mouse, and change the page, I want you to swallow. If you're watching a TV and a commercial comes on, swallow. If you like Netflix, there's no commercials, but maybe pick a character when they come on, swallow. Riding in the car, every time you stop at a stoplight, I want you to gather your saliva and swallow. This again switches and makes the unintentional intentional. It gives you an easy way to pair it with something to complete the task. All right, motivation. This is something else I'm passionate about. So with the reduction of dopamine, dopamine is highly related to motivation, that positive reinforcement. We already know once you've been diagnosed, you already have a reduction of 60 to 80% of that dopamine. So motivation is going to be a problem. This is really important for family members. You need an army of people to help you with this for better quality of life. You're gonna oftentimes see that your family member doesn't want to participate in the exercise, or you yourself don't want to participate in the exercise. You don't feel like going to the Neuro Challenge classes. You don't feel like going to the SPEAKOUT program, the loud crowd. We understand that. You have a lot that you're being asked to do to maintain this strength. But what can be very helpful is motivation from the family. Encourage, hey, let's go for a walk. Let's do our SPEAKOUT exercises. Why don't we try our swallowing exercises this morning? Establishing a routine is critical. When I wake up at 9 o'clock, I practice my exercises, then I eat my breakfast, then I'll do my SPEAKOUT exercises, then I can go for my walk, and just pairing it through the day with fun activities can be very helpful. You're going to need that motivation. I feel that helps with the frustration on both sides of the family member feeling like you don't want to do it, and you feeling bad that you don't want to complete the exercises. Take advantage of the wonderful programs we have in Sarasota. We're so fortunate for Neuro Challenge and all the programs that we're able to offer at Sarasota Memorial. I think there's pretty much an exercise program every day of the week, so pick which one you like. Some of them are online, which is nice. We definitely want you going in person because you get that social activity and that reinforcement. You get to practice everything we're talking about all in one. So what are my takeaways for today? Be proactive. Even if you've just been given your diagnosis of Parkinson's and you say, my speech isn't that bad, or my voice is fine, my swallowing, just a few times a week, my medicines stick. You don't want to wait until you choke or have serious aspiration problems to get intervention. It's much harder to backtrack. If we're proactive, and we get that exercise in early, the idea is that we slow the progression and the weakness of the disease. Motivation and family support, so crucial in your improvement and your participation in the programs. Again, it's not easy to recover lost ability, however, we can use intervention to slow the decline. Parkinson's will require lifelong deliberate changes, so that intentional side of the system. So it is going to be something where you constantly have to continue to exercise and participate in these speech and swallowing exercise programs. But making it fun, finding ones that you like, and pairing up with a partner or whatever, however you want to do it can be helpful. And again, you do need a physician's order for all therapies, physical, occupational, or speech therapy. But once you're in, we will complete that assessment and individualize it to your needs. Thank you very much. I hope this was helpful.